Treatment of Fabry disease with the Pharmacologic Chaperone Migalastat. Definition: Fabry disease is a rare, progressive, and devastating chromosome X-linked disorder caused by the functional deficiency of lysosomal alpha-galactosidase. The resultant accumulation of glycophingolipids, predominantly GL3, can lead to the multisystem disease and early death.
Fabry disease, a genetic disease caused by a mutation in the GLA gene, resulting in a deficiency of the enzyme alpha-galactosidase A, also known as ceramide trihexosidase. This enzyme is essential to the metabolism of a fat compound known as globotriaosylceramide. Without alpha-galactosidase A, this fatty substance accumulates in the walls of blood vessels, leading to narrowing and decreased blood flow to the tissues normally supplied by these vessels. Small vessels in the skin, kidneys, heart, and nervous system are preferentially affected, impairing function of these organs. Males with Fabry disease are more severely affected than females with it because the gene for Fabry disease is on the X chromosome. Males have only one X, whereas females have a second X and therefore some enzyme activity. Females with partial enzyme activity may not show any symptoms, or may have symptoms as severe as affected males. Diagnosis is made by determining the level of alpha-galactosidase in blood plasma or through genetic testing. Symptoms may include blood vessel-filled skin lesions known as angiokeratomas over the hips, buttocks, thighs, and lower belly with fever accompanying attacks of pain in the fingers and toes. Potentially life-threatening complications such as stroke, heart failure, and kidney failure may also occur. Treatment includes intravenously administered enzyme replacement therapy with a galsidase beta brand name, Fabryzyme, which reduces the fat accumulation in many types of cells and tissues. Episodes of pain in the hands and feet may benefit from medications such as diphenylhydramine brand name, Dilantin or carbamazepine brand name, Tegretol, also known as Anderson-Fabry disease and angiokeratoma corporis diffusum universae.
Fabry's disease is an X-linked recessive disorder. This is caused by a deficiency of the enzyme alpha-galactosidase A. Deficiency of this enzyme causes an increase in buildup of ceramide trihexosidase. Early symptoms of Fabry's disease include decreased sweating, also known as hypohidrosis, as well as the development of angiokeratomas. Another early symptom is episodic peripheral neuropathy. Later in the course of the disease, patients are prone to developing cardiovascular disease and renal failure, which is a common cause of death in this disease. So in short, Fabry's disease is an X-linked recessive disorder, which occurs from an alpha-galactosidase A deficiency. This leads to a buildup of ceramide trihexoside. Early signs of the disease include decreased sweating, or hypohidrosis, the development of angiokeratomas, and episodic peripheral neuropathy. Late signs and symptoms include cardiovascular disease and renal failure, which often are causes of death in this disease.
Application in medicine. Fabry disease is a threat based on the individual clinical presentation and can be diagnosed by enzyme assay, usually done on leukocytes to measure the level of alpha-galactosidase activity. An enzyme assay is not reliable for the diagnosis of disease in females due to the random nature of the chromosome X inactivation.
disease and renal failure are both major causes of premature mortality in patients with Fabry disease. Unfortunately, this challenge is complicated further by the impact of these two morbidities on each other. Cardiac involvement is common in Fabry disease, as lysosomal storage occurs within almost all cardiac tissue, leading to progressive structural and functional changes to the heart in over half of male and a third of female patients. Cardiovascular events are the cause of death in over 50% of patients with Fabry disease. Symptoms include dyspnea, heart failure, angina, chest pain, and arrhythmia. These symptoms can be attributed to the accumulation of GB3, which triggers intracellular signaling pathways that lead to cardiac hypertrophy and fibrosis. Left ventricular hypertrophy is the most important manifestation of Fabry disease cardiomyopathy, as it leads to progressive functional impairment. Structural changes of the myocardium cause reduced myocardial contraction and reduced velocity of myocardial relaxation. Higher hemodynamic stresses in the left side of the heart results in valvular thickening and deformation. Conduction defects and repolarization changes are present predominantly in patients with left ventricular structural abnormalities. Fabry disease also affects the kidneys, as GB3 accumulates in the renal glomerulus, causing progressive deterioration of renal function and ESRD. This in turn impacts on cardiovascular risk. It is often cardiovascular complications that are the cause of death in patients with chronic kidney disease. Once reduced GFR is detected, Fabry patients are likely to already have significant cardiovascular abnormalities. Understanding these complex and interlinked disease manifestations is central to improving outcomes for patients with Fabry disease.
Fabry disease is a disease that develops during childhood. It is caused by the buildup of fat in the body's cells.
This type of fat is called globotriaosylceramide, or GL3. GL3 is usually broken down and removed from the cells by alpha-galactosidase, or alpha-gal.
Alpha-gal is an enzyme. Enzymes are used in the body to aid with digestion and metabolism.
Fabry disease is caused when alpha-gal is not produced correctly or enough. This leads to gathering and buildup in the cells.
When the fat is gathering in the body, the blood vessels start to narrow. When a blood vessel narrow, it can cause a variety of complications.
There are many characteristics of Fabry disease. Some include episodes of pain occurring in extremities. People can also develop dark red spots, not being able to hear, not being able to sweat, vertigo, cloudy cornea, and hearing and gastrointestinal problems.
Fabry disease can have more serious consequences, life-threatening illness. Some of these include heart attacks, kidney damage, and strokes.
The symptoms can change depending on whether the person is a man, a woman, or a child, but these can occur in anyone with Fabry disease.
It can be difficult to treat, but carbamazepine as well as other nutritional supplements can have a positive effect on Fabry disease.
Nutrition also has an aspect on living with Fabry disease, especially if the person's kidneys don't function properly because of it.
Many doctors have prescribed diets that limit the amount of protein, cholesterol, sodium, lactose, and potassium. Fruits and vegetables are good for people with this disease because it limits the amount of blood your kidneys have to produce.
Living with Fabry disease can be difficult, but it all has to do with how you care for your body and what you eat. Thanks for watching.
Pros and cons. Pros. Migalastat, the oral pharmacologic chaperone administered in this study, has a unique mechanism of action. The higher volume of distribution of migalastat than of an enzyme replacement suggests that migalastat may enhance alpha-galactosidase levels in multiple organs, including the central nervous system. Cons. No change in substrate levels were observed in samples from patients with mutant alpha-galactosidase forms that were not suitable for migalastat therapy. Issue applied in Ecuador. In Ecuador, it is known of the existence of 25 people, several of them in Tena. On average, this disease has an incidence of 1 per 40,000 inhabitants, which gives us a reference that in Ecuador there should be 412 patients affected with Fabry disease. Conclusion. In conclusion, among patients with mutant alpha-galactosidase forms that were suitable or not suitable for migalastat therapy, the percentage of patients who had a decrease of 50% or more in the number of GL3 did not differ significantly between the migalastat group and the placebo group. Thank you.